Hi, I'm Isabella Galichia.
And I'm Dr. Jody Galichia.
And in today's video, we're going to be talking about congenital heart disease.
Congenital heart disease is an entity that occurs when you're born. So if you are born with a defect in your heart, that's congenital heart disease. Now, it can be of many, many different types. The heart could be too small when you're born, even too small to pump effectively. Or you can have valvular problems. So you may be born with a valve that does not work properly. You may be born with a hole in the heart, and that makes the heart function very poorly. But sometimes you have a combination of several of these things. The heart's not big enough, or maybe it's too big, and the valves aren't working properly, and there's a hole in the heart, which causes blood to flow in the wrong direction, and that decreases the oxygen capacity of the blood. So many things can occur, and there are many things that one can do about it. The best way to make the diagnosis is with an echocardiogram and then ultimately with a heart catheterization. And some people need to be treated very early in life, and others can be treated later. But shortness of breath, inability to exercise, improper growth curve, and in other words, you're not growing at the proper rate, and coughing, and generally problems with breathing. Those are the main symptoms.
Thank you. And what would be some of the questions that we should ask doctor?
Well, the first question is, when your baby is born, the doctor listens to the heart, and the first question you ask is my child okay? Is there any evidence of an artery that's damaged or a hole in the heart? Do I need follow-up for this? Do you need to do an echocardiogram to find out, is there a hole in the heart? Are the valves working right? As my child gets a little older, what symptoms should I look for? Or if there's sudden shortness of breath in my child, even as a baby, what should I do? And then lastly, if there are known congenital defects, how often does that need to be followed up? Is that something that you would check up once a week, once a month? How often do you want to make sure that nothing is getting worse? Some current congenital defects will get better on their own, but mostly not. So if there are major, major holes in the heart, they may need to be fixed right away. If there are small holes in the heart, that may never get worse and never have to be fixed. So there are many, many different kinds of congenital heart problems, including blocked arteries and even the arteries that lead to and from the heart. So these are things that require immediate looks and evaluations, fortunately, usually with a non-invasive test straight away, like an echocardiogram, and then follow up from there.
Thanks so much, doctor, and thank you for watching. Be sure to like and subscribe and visit hearthealthcommunity.com to learn more about the different types of congenital heart disease, and also to join our congenital heart disease group.